This is my presentation on fluorouracil. So to start off, it is also known as 5-FU, and it is a commonly known chemotherapy medication that is used in treatment of various cancers such as colon, breast, and skin. And it belongs to the class of medications known as antimetabolites. And this class are ones that interfere with the processes necessary for DNA and RNA synthesis in rapidly dividing cells, and cancer cells are those that are considered rapidly dividing. It exerts its cytotoxic effects by undergoing metabolic conversion within cells to its active forms, which disrupt the normal cellular processes, and this leads to the cell's death. It's commonly administered intravenously or topically, and it's been widely used in oncology since the 1950s and has become a very popular treatment to where it is continued to be used today in treatment for cancer. It is a potent inhibitor, and the structure of it is shown on the right there. And the way that it can be this inhibitor is it's converted into several active metabolites. The primary active metabolite is fluorodeoxyuridine monophosphate, which is also called FDUMP, like abbreviated. And this process involves enzymes such as thymidine phosphorylase, which is known as TP, and thymidylate synthase, which is known as TS. And reduced thymidine production impairs DNA synthesis and repair within the cell, and this disrupts DNA replication and leads to the accumulation of abnormal DNA strands. And that accumulation of those abnormal DNA strands triggers cell cycle arrest and apoptosis, which is very effective in rapidly dividing cancer cells, which rely heavily on DNA synthesis for growth and proliferation. Fluorouracil can also be incorporated into RNA molecules, which leads to RNA dysfunction and further contributes to the cytotoxic effects that it has. The way that it inhibits RNA synthesis, it can interfere with the normal metabolism of RNA precursors and incorporate into RNA molecules. And fluorouracil and its active metabolites can be incorporated into RNA molecules during transcription, and this replaces uracil with fluorouracil, disrupting the normal structure and function of the RNA molecules. Once it's incorporated into RNA, it can also impair the ability of RNA molecules to carry out their essential functions in protein synthesis, so this leads to dysfunctional RNA. Also, it can interfere with the processing of RNA transcripts, such as splicing and the modification steps. So this obviously disrupts the RNA synthesis and function. And the inhibition of TS and subsequent decrease in thymidine levels can both indirectly impact RNA synthesis. And reduced thymidine availability affects the balance of nucleotide pools needed for both DNA and RNA synthesis. So this overall just slows down the RNA production. The mechanism that fluorouracil uses is shown on the left here. Well, a diagram kind of showing it is shown on the left here. It first enters the cell and undergoes enzymatic conversion to several active metabolites, and like stated earlier, that's facilitated by thymidine phosphorylase. And FDUMP binds tightly to thymidylate synthase, forming a stable complex, and it normally catalyzes the conversion of deoxyuridine monophosphate to thymidine monophosphate, which is essential for DNA synthesis. And inhibition of TS prevents this conversion, which leads to reduced levels of thymidine and disrupts DNA synthesis. So fluorouracil and its metabolites, particularly fluorouridine triphosphate, also known as FUTP, are incorporated into RNA during transcription. Then RNA polymerase can mistakenly incorporate FUTP instead of UTP into RNA chains. So the RNA containing fluorouracil is less stable and can lead to errors in transcription, which affects the protein. fluorouracil's inhibition of TS also influences the balance of nucleotide pools within the cell, like stated earlier, and reduced availability of thymidine and alterations in those nucleotide pools, such as reduced UTP levels due to the incorporating FUTP. Those can further impair RNA synthesis and limit the substrates needed for RNA polymerase activity. Overall, the consequence of fluorouracil's inhibition of RNA synthesis, it just disrupts the cellular metabolism and function, especially in rapidly dividing cells like cancer cells. This disruption contributes to the drug's cytotoxic effects and makes it so effective in treating various cancers. So, in conclusion, fluorouracil is effective in inhibiting cancer cell growth by disrupting DNA synthesis through inhibition of TS. It incorporates RNA molecules during transcription and impairs the structure and function. And that inhibition of TS disrupts nucleotide metabolism and reducing thymidine and affecting RNA synthesis indirectly. These mechanisms collectively induce cell cycle arrest and apoptosis in rapidly dividing cells, which is critical in cancer treatment since that targets the exact kind of cells that are involved in cancer. And overall, fluorouracil's dual action on DNA and RNA synthesis is the main reason that it's so potent as a chemotherapy agent and is effective against various cancers and used commonly today still. And those are my sources.